We know this afternoon there are thousands of Iowans, perhaps some of you watching, who are in an abusive situation, don't even know where to turn. Fact of the matter is, all 99 counties in our state had convictions last year for sexual assault, domestic violence, and stalking. Nearly 3,000 convictions in all. The state of Iowa is using this National Sexual Assault Awareness Month to let victims know that there are services out there. And here to tell us about that, we have Iowa's Secretary of State, Paul Pate, and University of Iowa Hospital's sexual assault nurse examiner, Katie Rasmussen. We're grateful to both of you for being here. And Secretary Pate, I want to start with you. You're the guy who always comes out to talk to us about elections and election security. Why is this a cause for you and your office?
Well, first, on a personal level, it's something I've had a strong interest in since my days as a tenure as a state senator, in trying to help prevent these kinds of attacks and to give programs to help victims of these attacks. But on an official capacity as Secretary of State, voter registration. It's a public record. When you register to vote, you shouldn't be penalized by having that public information out there for people who are trying to come back from being a victim. They're trying to come out of the shadows, and they don't need to have that information out there for the bad actors to be able to find it. So our office spearheaded the program to create an address confidentiality system. So for those of you who have gone through this, you can sign up and we will put you into this program so that your public records are no longer public in that sense. We would give you a substitute address. So for all your public records, this would serve as your source. So the bad actors won't be able to track you down and you can feel safe in your home again.
Katie, when you're one of the first people encountering these victims, is that a real concern of theirs? Is that something they share with you, the idea that they might be found?
Yeah, it may not be the first thing, but safety in and of itself is one of the first things that they are concerned with. So having that going forward, knowing that they can keep that information confidential is really a good security net for them.
And do you have a specific message, since you've got a big audience this afternoon as a nurse and someone who has been helped people through a lot of these situations, someone who hasn't come forward yet? What's your message to them?
Yeah, I think the most important thing, especially during COVID, is we've seen a decrease in the number of people coming in for help after an assault. So letting people know that the ERs are available and that sexual assault is a medical emergency and they deserve to have treatment. They can be seen by a sexual assault nurse examiner for free. You know, they will not be charged for that visit, and you know, they deserve to have that health care.
One source of help here, the Iowa Safe at Home program. Is that something you're referring to as well?
Yes, we'd like to encourage you. Look at safeathome.iowa.gov, but there's a hotline number we want to make sure everybody knows about too. And that's our 800-284-7821. That's the Iowa Sexual Abuse Hotline. And that's our main source for about any kind of questions you might have for everybody. We're one tool, one resource out there to help people. As was mentioned, we have far too many people who are victims. We have over 660 folks in our program representing over 63 counties. So it's not just an urban issue. This applies to any county.
Katie, are you seeing an uptick now with numbers of people who are, now that some restrictions have been lifted, coming in to seek help?
Yeah, we see a large fluctuation in our numbers, and the concern is that with people being quarantined at home, that maybe it's not safe for them to leave, or like I said, they might not feel like it is safe for them to go to the hospital. So just want to reassure people that all the safety measures are in place to help protect you from COVID and other things, so that they should really be seen for that health care.
Well, the numbers speak for themselves. 1 in 5 women and 1 in 38 men become victims of some type of sexual assault at some point in their lives. So thank you both for reaching out and helping those folks, and for this Safe at Home program as well. We got the website up on the screen. Secretary Pate, Katie Rasmussen, thanks for being here this afternoon.
Thank you, Dan.